million. And Wednesday also saw another sharp increase in deaths. More than 2,000 people died from COVID-19 complications. That is the largest daily death toll since July. Overall, 263,000 Americans have lost their lives since this pandemic began. Let's go live to Dasha Burns in Johnson City, Tennessee this morning, where healthcare workers are stretched thin on this holiday. And Dasha, tell us about the situation for healthcare workers there that you're learning.
Hey, Corey, good morning. This hospital behind me is the largest in this part of Appalachia. It is part of Ballad Health system, which is the only hospital provider in about 21 counties in this largely rural area. And in this building behind me, there are nurses who right now are caring for patients who are fighting for their lives. There will very likely be calls made to funeral homes here today because the record number of deaths here in just the last couple of weeks. And at this point, the rate of admissions is outpacing the rate of discharge, which means there are more patients coming into this hospital than there are coming out. And that is putting a significant strain on health workers here. And so I want to turn it over to one of those folks who are on the front lines of this thing. This is Stefani. She has spent 900 hours in the COVID unit here. And Stefani, I just want to give you the floor. Tell us what you've been seeing here.
It's been very difficult. I often compare it to a marathon in where you prepare your training and you think you're prepared, you sign up for it, and then you get here and the demands and everything on your body, you spend hours, some days 15 hours here without eating or drinking, and then you feel like you're ready and you make those phone calls to families, you sit with patients in their last moments, and it's just difficult to explain the emotional toll, much less the physical toll of all of us. We have a great team here, but it's difficult. It's extremely difficult.
And how are you doing? How are you feeling? You actually just recently recovered from COVID yourself.
I did. I've been out 14 days. I'm feeling very weak today, very tired, but my heart is here. You know, this is where I'm needed, and I want to be here for my team members. There's too few of us to be out.
Stefani, thank you so much for taking the time. We're going to let you get back to your important work. And Corey, this is the problem. As much as bed capacity is a concern, the real concern is the staff, the burnout, and the fact that nurses are getting sick themselves. Ballad Health has about 250 team members who are currently positive for COVID, quarantining and recovering, and they are looking for as much help as they can get right now. Corey?
It's hard to put into perspective how many hours these frontline workers have put in, some 900, and then collectively, wow. Dasha Burns, thank you so much for that incredible report this morning. Very important. Joining us now, Dr. Jeremy Faust. We want to bring him in. He is an emergency room physician.